Good evening, everyone. It's David Porter, and tonight I want to talk about the different types of mental health professionals. Probably the best known type of mental health professional is a psychologist. A psychologist is someone who has completed an advanced degree, either a PhD or a PsyD, which is a Doctor of Psychology degree, and they have completed typically anywhere between 2,000 and 6,000 hours of supervised clinical practice, and they have passed a very rigorous written exam. The total time that it takes to become a psychologist is going to be about a decade or longer. You have to have 4 years of undergraduate, a bachelor's degree, and then another 2 years for a master's degree. Actually, you can take up to 6 years to complete a master's degree, so 2 to 6 years for a master's degree, and then anywhere between 5 and 7 years for a PhD or a PsyD. The difference between the two degrees is a PhD is the traditional Doctor of Philosophy degree, and it is very research-oriented, and the PsyD is more of a clinical degree, and there's going to be less emphasis on research. And for a PhD, the doctoral student or doctoral candidate will typically have to write a dissertation, which is a book-length piece of original research, which they then have to defend orally in front of a panel of their peers, their professors. And the PsyD is, again, much more clinically oriented. You may not have to do a dissertation. You're still looking at about a decade of study and training before you can be licensed for practice as a psychologist. The supervised clinical practice that I mentioned, the doctoral candidate will be doing on-the-job training, seeing patients, doing evaluations and diagnoses, doing psychological testing, doing psychotherapy, and writing progress notes and treatment plans, and when the patient is finished, termination of treatment plans. A lot of meticulous record keeping is required, and the candidate will be doing pretty much the same tasks as a licensed psychologist, but the difference is they do it under the supervision of a licensed and experienced psychologist. They will meet with him every week, and their cases will be reviewed. They'll have an opportunity to ask questions and get direction, opinion, advice, feedback regarding how they are doing psychotherapy. The supervising psychologist will review any psychological tests they've completed, any written work they've done, and sign off on it or return it for editing. So this is a very long and arduous process. A psychiatrist is different from a psychologist in that a psychiatrist is a physician first and foremost. They're going to have an MD or Doctor of Medicine degree, or a DO, which is a Doctor of Osteopathy degree. That's a different type of medical degree, which it's similar requirements to an MD, except that DOs cannot do surgery. They cannot be surgeons. Only MDs are also qualified to become surgeons. So again, this is a decade-plus process because you're looking at 4 years of undergraduate, typically in a pre-med program or a physical science or biological science, chemistry, physics, biology, of course, and then 4 years of med school, and then a 3 to 5 year residency where the new physicians will be training specifically in the prescribing of medications, diagnosis of mental illness, and they will also be taught how to do psychotherapy. So the similarities are psychiatrists and psychologists can both do psychotherapy. Psychologists specialize in psychological testing, and psychiatrists specialize in medication management, in evaluating the patients for the medication and writing prescriptions, and then doing periodics every 4 to 6 weeks. They meet with the patient for 20 minutes, 30 minutes, just to check on symptoms, side effects, and if the dose of medication has to be increased, lowered, discontinued, something different tried. And again, they also do psychotherapy. So being a psychologist or a psychiatrist is a very worthwhile career to pursue, but know what you're getting yourself in for, because it takes a great deal of time and a great deal of preparation. Okay, thank you for watching, and please hit subscribe, and in the comments section, feel free to leave any questions, or if there are any videos you're interested in, any topics you're interested in on psychology, criminology, forensic psychology, substance abuse, personal growth and development, motivation, any topics that interest you, leave a suggestion and I'll consider doing a video on it. Thank you for watching.